The John F. Kennedy Medical Center once stood as the premier medical facility in West Africa. Years of war has reduced JFK Hospital to a fragment of its former self.
It was built as a tertiary hospital to serve West Africa.
Dr. James Sirleaf is head of Heart, Health, Education, and Relief through Teaching, an organization committed to re-establishing JFK as the central point in rebuilding Liberia's healthcare.
You change healthcare and make healthcare sustainable by training people. You can train people, hardworking, dedicated people, to do anything. If you dedicate it into training them, you can change the manpower and then change the healthcare in Liberia. And that's what HEARTT wants to do. We want to be dedicated to training healthcare workers at JFK and providing them the equipment to make a difference in the healthcare in Liberia.
Dr. Sirleaf's vision is to transform JFK into a first-tier medical facility, providing services and workers into the Liberian healthcare system.
What resonated with me and with the team was the emphasis on education. So the hope through HEARTT that we would be able to participate in a program that provides infrastructure and the capacity for long-term changes.
On a recent trip to Liberia, HEARTT volunteers were able to see firsthand the challenges facing the rebuilding efforts.
What we tried to do when we were there was to not only focus generally on the facilities, equipment, and personnel that were needed to rebuild JFK and the healthcare system in Liberia, but also on specific programs that could partner particular HEARTT volunteer expertise with the needs of JFK.
Some of the basic trauma center type expectations are not there. The people who respond to an emergency are, they understand some of the protocols. They certainly know how to assess patients on some levels. But again, it depends on what it depends on whether X-ray is working. It depends on whether the lab is open. There was a lot of overcrowding in the emergency room. Children and adults were mixed all together. So everyone was trying to do as much as they possibly could, but there's a lot of systems work that needs to happen there.
HEARTT's approach to rebuilding Liberia's healthcare is comprehensive. Volunteers quickly realized that HEARTT's vision of rebuilding is practical.
I think HEARTT really tries to get to the broadest audience possible. It understands that in order to really make long-term changes, that you need to educate all along the pipeline, from the students all the way up through the attending physicians.
You have to have a central hospital that has the brains and the expertise to handle cases that people from around the country can bring these cases to. We're hoping that JFK becomes a center that people who cannot afford and need these healthcare issues can be solved at JFK.
HEARTT is now organizing an HIV and AIDS conference in Liberia in the spring of 2008. The focus is to promote awareness, provide education, and training for those working around people afflicted with the disease.
One of the problems in several of the other African countries and in Romania is that the healthcare professionals began to become HIV positive so frequently that you were losing the workforce at the same time you were losing the population of HIV. So we really need to focus critically on keeping the health of the healthcare force so that they can participate in keeping the country healthy.
This particular conference, I think, will be incredibly useful in terms of bringing together HIV care providers and practitioners from all over Liberia so that they can continue to work to develop programs that work for the country in terms of HIV.
HEARTT and its volunteers are hopeful that Liberia's healthcare system will someday serve as an example of excellence, converging policy and practice at the highest level.
Our vision is to have a residency training sites in Liberia where residents, the best trained residents from some of the best residencies in the United States are in Liberia, in pediatrics, emergency medicine, surgery. Get people and their attendings coming there for stints of time. That's one thing we want to do. We want to open a hypertension clinic at JFK. We want to be involved in the teaching of the residents where we can have rounds at JFK. We want to provide equipment to JFK, ultrasound machines, CAT scan machines. That's what the vision of HEARTT is for John F. Kennedy Medical Center.
Building up JFK will have tremendous impact for all of Liberia because that is where people are going to learn.